Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Sayyidina Muhammad. So we have this emergency podcast here. Dr. Albakri, myself, and we want to talk about the healthcare crisis, mainly to focus on that in Gaza. This is probably the biggest catastrophe that you can imagine in healthcare that I've seen in my lifetime. Gaza consists of 2 million people. Gas is cut, no fuel. Hospitals are shutting down. About 60% of care clinics, urgent cares are closed. Among other things, we have possible outbreaks of cholera, of other bacterial infections, infectious diseases, big comorbid conditions like chronic, like heart failure, CKD, all that are being unmanaged. Diabetes, it's a big crisis. Not just in the trauma sense, but also there's a space that's not being focused on, and that's chronic condition management and mental health. But we just kind of wanted to talk about how medical aid changes during war. Right. How basic medical aid changes during war. We know there's trauma. We know there's chronic conditions. Right.
I mean, at baseline, we're talking about a population of people at Gaza that do not have a basic functioning medical system. Now, the medical system in Gaza depended on the aid of Doctors Without Borders and PCRF and the WHO and UNRWA and all these different organizations to provide them with the necessities, to provide them with the raw materials. It's very expensive nowadays to deliver healthcare, especially with a lot of chronic conditions. These are people that have been under siege for 16 plus years. The amount of complications that have happened. If you imagine healthcare here, we usually catch things a little bit early so we can manage them. But when you go late stage, whether it's dialysis, heart failure, infectious disease, chronic wounds that get cut off, you have very late stage complications. It's much more expensive at that point to deal with that. Now you look at an infrastructure that's completely collapsed there. And nothing's functioning. The hospitals don't have the adequate resources. And then you stress the system by bringing in over 4,000 people killed, XYZ people injured. I mean, we trivialize the injured number. Right. Some of these people have a hand blown off, a leg blown off. When we say injured, these people are functionally can never walk again.
Yeah. Okay. Yeah.
So now you need people to take care of those people. You need rehab for those kind of people. So there's so many things that are stressing that system, and it's already stressed to begin with.
Yeah. And then all other types of care also is different. For example, if your patient has heart failure and they're taking Lasix, well, now there's no water.
Yeah.
Like one Gazan per day is living off of less than 3 liters of water.
Right.
With the water being cut, and So what happens if you continue taking Lasix? We know.
Right. Like the FEMA guidelines say that, in a catastrophe situation, you should have about 1 gallon or 4 liters of water per person per day.
And what is that? Can you explain what that is?
So FEMA is like the disaster organization that we have here in the United States that addresses different catastrophes, whether it's weather or some kind of, outbreak of something. And they suggest that if you want to prepare yourself, you should have 2 weeks of 1 gallon per person per day available to you. And Gazans are surviving under 3 liters a day, if that. I saw a picture today of a small boy holding water bottles, and it was like he won the lottery. Because they found water bottles, because that's not available. And regardless of the politics, regardless of any of that, humanitarian aid should be allowed to enter. There are people ready. There are people on the Egyptian border at Rafah ready. Yeah. I've been in contact in our group chats with the PCRF. They're ready. They want to go. Yeah. Like there's a lot of people are wanting to go over there and help, but it's not being let in. And this is a group punishment to everybody in the city. And like I said, this is not a political podcast. This is a health-focused emergency podcast where we want to say that we need to have adequate medical care for the people of Gaza, both chronically and acutely for the trauma situation.
Some conditions that are going to arise during these moments when you have people being displaced from their homes and the medical aid not being addressed. So in infectious disease, we're going to have a rise of salmonella, shigella, cholera. Right. You're going to have all of these things.
Because the closer people are together, the dirtier the water supply. You're going to have fecal-oral spread. People aren't having enough sanitation. They're not able to wash as much or as often. So you're going to have easy spread. And then, they displaced the northern Gaza into southern Gaza. So you're taking 1 million people and sandwiching them over another million. So now you're going to have more outbreak of disease. Viral illnesses are going to spread. We just came out of a pandemic where people were saying, social distance, blah, 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 blah. But if you have cholera and one person gets it and they're not getting antibiotics, they're not getting oral rehydration therapy to hydrate them, because diarrhea is actually one of the biggest causes of death globally.
Ya Allah.
People don't know that.
I mean, and it's like a double-edged sword. Like you drink, let's say you drink water. There's dirty water that you drink.
Right.
You get cholera, you get diarrhea.
Right.
And the way to replenish yourself is basically to hydrate.
Right. Electrolytes. You need sodium. You need sugar. You need all that stuff.
But I mean, you don't even have water to. You don't even have the.
Right.
The
and
base.
if you show up to the hospital with one of these infectious diseases, they're going to be like, hey, we got other problems to deal with.
Exactly.
And not,
they're not being addressed.
And
they're not being thought about.
Exactly. And not to mention the doctors that have died in this. Like there's like every day, like, hey, this doctor died.
I think there's about 16 doctors that have already been killed.
Yes.
And like hundreds, like, 16 healthcare workers have been killed on duty. 27 have been injured. So and that's not even like discussing the exhaustion.
Right.
Like I was watching a video today. One of the doctors was saying we're taking care of 10 patients at the same time.
Right.
Like you literally have beds of kids, about 3-4 kids.
Right.
And the doctor goes listens to the heart of each one like differently, and it's like
factory line medicine.
It's the saddest thing, man. Yeah. And then you see one of the doctors just helpless hugging hugging a patient. Like,
right.
And then crying with them. They're overwhelmed.
Right.
They're overwhelmed.
And they're thinking, like, my family back home, are they safe? Everybody knows somebody that's passed away, whether it's a cousin, uncle, brother, whatever it is. So you're talking about they're already emotionally exhausted. They're physically exhausted. I mean, this week in the hospital, we were having a hard time functioning because of seeing the news of what's going on. Okay. Imagine if you're there as a physician. And you saw the video of that one doctor where they told him that his son died. He had to walk down to the morgue. Imagine that.
Man, it's like these doctors are working day and night.
Right.
They're working with little resources.
Right.
Their hospitals are getting bombed, and honestly, what's their how are they being compensated?
Right.
Like literally, one of the doctors was given his dead grandson in his arms. Like this is their compensation. Is like dead family members. Is more catastrophe. When these people, they're in my opinion, like heroes. Mm-hmm. Like these people should be winning Nobel prizes.
Right.
Like imagine being a doctor in war, being told to evacuate a hospital which has babies in the NICU on generators requiring electricity, and you leaving. They're not going to leave.
Right.
They're not going to leave. They're going to do no harm.
Right.
They're going to do no harm and no injustice. They're not going to leave. We told you guys to leave. I'm not going to leave.
Right.
It goes against everything I live for.
Right.
And I'll be a coward if I leave. Right. That's how they're thinking. So, you have in Palestine 1/4 of the babies that are born, they're born preterm.
Wow. In Gaza.
In Gaza.
Wow.
So why we need the fuel? We need to stay in these hospitals. We need care to be provided to these
basic
patients.
Resources, antibiotics, anesthesia. Like I saw a doctor tweeted out that we're doing surgeries without anesthesia.
Without anesthesia, that's insane. Right. That's insane.
I mean, they were talking about something from the 1500s, 1400s. Yeah. This is like archaic medicine that they're having to practice there, which is completely unacceptable. And the thing is, the resources are there. Like, people do want to help. Like, alhamdulillah, there are people, there's ahl khair, there's people of goodness that want to provide the resources. They want to donate. They want to bring in the resources. Doctors are willing to risk their lives to go in, but the borders are not being opened.
They're not being
opened. The Humanitarian Corridor is not being allowed. Like, there should be places like, hey, these are tents. They're set up by third parties. You can't say that it's a political thing. That, hey, you come here, you get treated. No one's going to say anything. And you're safe.
Right.
But that's not being offered.
That's not being offered.
In any other situation, that would be. But because the Gazans are seen in this animalistic, subhuman way, people just ignore it. But there's people that need basic medical care, and everybody knows that it needs to be offered. But because of the climate and how the world views the Gazans, everyone's just turning a blind eye. It's like, hey, well, they had it coming.
I kind of wanted to talk about just the regular Gazans that are evacuating, that are in their homes, that have not been that have not been bombed, that have been the lucky ones.
Sure.
How is their medical care being managed now and in the next few months? What's going to change?
So at a base, there's going to be less food, less water, so you're going to have, starvation.
Talking about less food, did you hear about the bakery that supplies 100,000 food for 100,000 Gazans was blown up? So less food.
So you're going to have like starvation, ketoacidosis. You're going to have different types of protein malnutrition, kwashiorkor, and these are the baseline nutrition of Gazans is already poor.
Right.
They're not at a baseline very healthy and robust of a population, given everything they've been through. And you're gonna have starvation. You're gonna have dehydration. That's going to lead to kidney problems. So, I mean, we can go head to toe. Neurologically, psychologically, people are going to have PTSD. They're going to have psychological disorders. Like, you see these kids. There's this video of this kid that they found in the rubble, and he was shaking. And my mom showed me the video. And was like, is he having a seizure? I'm like, no. That's part of the fight or flight response. Because the fight or flight response is fight, flight, or freeze. So have you ever seen a rabbit that gets scared? It it just shakes in place. So now for the rest of this kid's life, he's marred by that. That's that situation. You see kids like saying goodbye to their parents. All these kind of things are going to add up. So you're going to have psychological disorders beyond what we see here at baseline. Going down, people that have thyroid disease, they're not going to be able to get thyroid medication. They're going to have all these different complications. Heart disease, like we're talking about CHF. They're already on diuretics. They're on different medications. But because of the changing diet, the changing nutrition, they're going to have to change that. Like if someone's on warfarin for anticoagulation, and we don't want to get too technical here, their diet influences how much their warfarin dose is. So who's checking their INR? Who's doing that? If they have some kind of lung disease, COPD, how are they getting the inhaler, especially with all the dust and debris that's rising?
They have CKD, how are they getting the dialysis?
Yes, dialysis. If they progress to ESRD, or if they're CKD and they get dehydrated, they push their kidney disease worse, and they're not getting the adequate care. If we're talking about diabetes, type 1 diabetics without insulin die.
Right.
And type 2 diabetics without insulin, they're going to have complications. For example, if you're a type 2 diabetic, you're not properly managing your disease, you get a small cut on your foot, and that progresses to a diabetic foot wound. Now you need surgery to cut that off.
And now you're getting less glucose in the blood because you have less food, so you're going to have to adjust your insulin requirements, so you won't.
Assuming you have insulin.
Yeah, assuming you have insulin.
Right, because insulin has got very expensive here. So imagine what's going on there. And then you're talking about all the musculoskeletal injuries and stuff. On top of that, a good proportion of the Gazan population is already missing a limb, is missing a leg, is missing an arm from the previous incursions. So you're talking about people at baseline that need physical therapy. They need different kind of devices to help them walk and move around.
Wound care management. You might get osteo. You might get sepsis from that. It's SubhanAllah. Infectious disease, I think we kind of hit on it. But now let's kind of talk about, like, I guess what we can do. I mean, it's little, but there must be some ways. There must be some ways, right? For example, mental health counseling, or just basic disease management. Are we able to do some sort of telehealth?
Yeah, so that's what we were discussing before this, that, theoretically, the doctors there are overwhelmed in dealing with the acute problems, but we as a community can step up and help them and potentially see people over the phone, over video devices, and manage their chronic conditions, their congestive heart failure, their type 2 diabetes, adjust the dose of medications so people can stay healthy in spite of what's going on. And it might seem trivial that, like, people are getting blown up and they're getting completely blown to pieces, but these other people still need the care.
Right, because in the long term, that's what's going to kill them.
Right.
Yeah.
So I think there is a window for us in safer countries to at least try to give back, to give our time resources to help, manage these people's care, perhaps come up with some guidelines, come up with some kind of...
guidelines, okay.
Right. We can even employ AI to have an algorithm. Like, if you have this, you do this. It's a little advanced, but it can be deployed in other places in the world too when outbreaks happen.
Absolutely.
And this is something that can help people manage their health when the healthcare system is stressed out.
Right. So I've already had around six doctors or MPs or providers that said they're willing to tell us, and we just kind of released the form about an hour ago.
Yeah.
So you're gonna have people that are gonna be there to
assist and want to help.
Say they want to help, of course, for sure. But then the question is is there adequate Wi-Fi for the patient?
Elon Musk put on the Starlink. Elon Musk put the Starlink for Ukraine. I think putting the Starlink for the Gazans allow us to administer care there, and allow us to connect providers here in America and the West and other countries to people in Gaza so that they can help manage whatever chronic disease is going on. I think that would be invaluable.
Absolutely. And I've been trying to pressure on.
I see that.
On social media, on Twitter.
I'm gonna tweet at him too.
No. And, just encouraging everyone out there that's listening to it. Right. Your voice matters. Go to the. You don't know who's gonna read your comment.
Right. You don't know. I've had people reach out to me on social media I'm like, whoa, how did you find my stuff?
Right.
It's very interesting.
And I just want to kind of also address the silence in the medical community.
Yeah.
What's the fear? I mean, we went to medical school. We learned what's good, what's right, and what's good and bad.
Right.
And now we're seeing it in front of us, but is it fear? Like, are people afraid to lose their jobs? Afraid to? I feel like the first people that should be talking about this are the medics.
Yes.
Are the medical professionals.
Right, because politics aside.
Politicians.
Yeah, politics aside, the medical community should stand up and say, like, hey, you need to provide medical care to Gaza,
Absolutely.
period.
Absolutely.
Like, there's no ifs, ands, or buts about it. Like, medical care must be delivered in Gaza no matter what. No matter what happened, what's going on, what other, the geopolitical context of the situation would take hours to discuss. But medical care, period, needs to be provided. We have a Geneva Conventions. We live in the 21st century, and this is the standard. We're not living in the 1200s when people are sieging cities and blocking off stuff. That's the kind of war we're talking about here. It's like siege warfare. We're hopefully past that. And I think the Gazans should be provided the health care that they are entitled to.
Why do we think they're not getting?
Why they're not? So I think that there's like this pressure from everyone else. Like if you support the Gazans, you're somehow supporting the enemy, somehow supporting some kind of evil group. But these are kids that we're talking about.
Yeah.
These are kids that were born already, and this is the 5th or 6th incursion that they've gone under, where they go to sleep, they don't know if they're going to wake up, they don't know if they're going to be bombed, their house is going to exist. I saw a kid with a backpack on today, he's like, I don't want to die, I don't want to die. They should move. So these are kids that are already psychologically damaged, and you're telling them, no, we're not gonna allow medical care in as a collective punishment? Absolutely not.
They call them human shields.
Yes, yeah. And that's just a hand-wavy thing, like, oh, they're human shields, so they get to suffer.
Yeah.
And you saw Bassem Youssef go on there. Okay, they're human shields. What is this going to be accomplished by blowing Gazan kids to shreds? Is that going to make life better for anyone in Israel, in Palestine, wherever it is? Is that going to make anyone's life better? Absolutely not.
Exactly.
And by the way, these types of videos of the Gazan suffering, they do not circulate amongst those circles. That is a problem. Like the videos of the Gazan suffering, it's like there's like a mute on it. Like they don't circulate to other people. And I think even the other side, they would see that and their humanity would reactivate. And
do you think it's that they don't share it, or like it just doesn't reach their algorithm?
Because it's gory, it gets blocked. It's gory. I mean, the suffering is intense. Like the stuff you get on WhatsApp, it's intense. And then some people like to push a narrative. Understandably so, the other side is pissed off, and they are saying, oh, this is all from a different era. This is old videos. These are fake videos. And there's like the fog of war. The fog of war murks people's minds. You get in this like tribal mindset, and it's like our tribe versus their tribe. And it's like, oh, our kids suffered, so their kids have to suffer. But unfortunately, as doctors, we don't accept that. We don't want any kid, anybody, not it's a Palestinian kid, Israeli kid in Yemen, a kid anywhere in the world, should not be given medical care.
And we feel a moral responsibility for addressing it.
Yes.
For spreading these ideas.
Right.
And making sure that aid comes in.
Right.
I mean,
period.
Just the basic medical aid. And there's also something that I've also noticed, like the Gazan people are looked at a little differently. They're looked at as inferior.
They are.
Like the way they're addressed. We saw the tweet by the Prime Minister of Israel, calling them children of darkness.
Yes, yeah,
saying we're the children of light and they're the children of darkness.
Yeah, and that's very dangerous language because that leads to genocide. So that's the language used before somebody enacts some kind of evil act because you justify it. You have cognitive dissonance. Okay, they're evil, so I guess justify in killing them.
Exactly.
So
because
it's dark.
They're less human. It's easier to kill someone that's not human.
Yes, they call them chayot mahmat, which means human animals.
Ya Allah.
So like, if you dehumanize somebody, you can kill them. If it's a human being, I can't kill a human being. An animal, a mosquito, a rat. Yeah, like Bassem Youssef said the Nazis called the Jews rats, and that justified them in killing them, which was horrible.
Exactly.
But we can't allow the Gazans to be dehumanized in this way.
Right.
Absolutely not.
And what's crazy to me is like it's happened before. We've seen it. We read about it.
Same playbook.
It's happening again.
Right.
Same thing.
Action items.
The first thing is, inshallah, I mean, there's low expectations of this right now, but as soon as medical aid comes in to the border, we all have to be prepared. We have to be ready. Yeah, we should push for that to be opened up. I guess that's step one. Number one, we need to push for that to go in. We need to talk to your local congressperson, whoever it is, get social media awareness out, and tell that it's unacceptable that medical aid is not in, period. Exactly.
Red line, and it doesn't matter where you stand on the political spectrum, medical aid for children, for pregnant women, for injured, needs to happen. So every human being can do this? Yes. Okay. Number two, if you can provide the aid. Yeah, if you can help provide whatever it is, money, food, resources, whatever it is, provide. And alhamdulillah, there are people of goodness. They are on the border already. Right. I saw a video of like trucks just waiting to get to Gaza. So every time there's a Gaza incursion, people are willing to come together and to help out.
Right.
There are rich donors in the Gulf and throughout the world that they're willing to give money to help Gaza.
Right. And so whoever's listening to this, there are organizations that are raising money.
Right.
You can go, there's a lot.
Yes.
I mean, on my profile, I have like 3. As soon as they open the borders, we're going to just flood it with aid.
Yes.
Inshallah.
So there needs to be safe aid delivered too. So that's number 3. There needs to be humanitarian corridors set up, like neutral party zones, whether it's the UN or whoever comes in and says, hey, this is safe places. You can come get medical care here. There's no risk for your life, period.
Right.
Number 4.
3, I think.
The 3 is the corridors. So one is open up the gates. Number 2 is provide what you can. Number 3 is make sure there's corridors allowed, humanitarian corridors, especially in southern Gaza where people are being moved to.
And number 4 is we're going to need a lot of help.
Yeah, the telehealth.
The doctors there are burnt out.
Yes.
We need to offload them. We need to help them out. We need to focus on the things that they're not focused on.
Right.
So telehealth organizations like
PCRF. Right.
And doctors.
And because they already have a network on the ground, like PCRF has people on the ground there.
Exactly.
I mean, I hope they're safe.
Exactly.
It's the thing. Exactly. So like their infrastructure is probably a little damaged now, but they have people on the ground that they can, once everything's open, they can provide the care necessary. And we urge, there's been votes about ceasefires and all these things. Like we are pro peace, we are pro ceasefire, we are pro everyone going home to their families, whether it's hostages, whoever it is. People go home to their families, and we need a just resolution to what's going on.
Right. Is there a number 5?
The telehealth, like if we can provide mental health services to the people in Gaza, if we can provide decentralized access to care from here. That would be great. If someone has some kind of experience with this or some kind of information, like maybe the Ukraine war, if someone has information, that'd be great. So we can take that model and
definitely reach out to us.
Gaza. And we want, if Elon Musk is listening, we need to have internet in Gaza so we can provide these kind of services.
Absolutely. I think that does it.
Sure.
Wood, it's great talking to you.
Always.
I hope this podcast has some benefit to people.
Inshallah.
And allows aid to come into Gaza and, ease the suffering.
Amen.
يشفي المرضى. Everyone that's going through a trauma, going through anything.
يصبر أهلهم.
SubhanAllah, man. لا تنسوا يعني Allah subhanahu wa ta'ala says in the Quran, like, ولا تهنوا ولا تحزنوا.
Yes.
Don't feel weakened and don't be sad. So.
And Allah says, ومن أحياها فكأنما أحيا الناس جميعا. Whoever saves one life is as if he saved all of the world. Ironically, this is a concept that's found both in the Jewish texts and in the Quran. This is something we share. So we need to have medical care provided. Like, let's stand at the line. And let's not.